On this Friday night, Omicron overwhelming understaffed hospitals. Fresh pleas to the unvaccinated.
Healthcare workers will express frustration.
The talk of making vaccines mandatory, plus the complications and consequences of canceling in-person classes.
We are seeing a drastic increase in self-harm behaviors.
And Indigenous communities' COVID outbreak and cry for help.
We're remote and we're First Nation. People don't give a damn.
Prison punishments. The 3 white men who murdered Ahmed Arbery are sentenced. Plus, the defiant one.
But if you want it to be right here, right now, that's okay with me.
A groundbreaker of stage and screen dies at 94.
Global National with Donna Friesen.
Good evening and thanks for joining us. We begin with a look at what's happening in Canadian hospitals. They are filling up with people who have COVID-19 because the Omicron variant is spreading faster than any other version of the virus. Ontario is the latest province to have more people in hospital with COVID now than at any other time during the pandemic. Almost 2,500 people are now hospitalized with COVID in Ontario, a record high. The majority are unvaccinated. And today, the federal health minister had this message.
Rapid tests are not going to end the crisis. Rapid tests are not going to solve COVID-19. The only thing that will solve COVID-19 is vaccination.
Many hospitals operated at maximum capacity before the pandemic. Now, even though they've postponed non-urgent surgeries and procedures to help free up capacity, they're concerned about what's coming. Eric Sorensen has our top story tonight.
There's no hiding, no sugarcoating the data. The Omicron variant surge is a crisis, getting worse by the day. COVID case counts in Canada have spiked 400% higher than the peak of the third wave, a 7-day average of 42,000 cases daily. And that is an undercount of the real numbers, which are simply going through the roof. Now COVID hospitalizations are also going up. Not as high as in previous waves yet, but now above 3,600 and rising sharply. It's true many cases aren't as serious, but the numbers in intensive care are also climbing.
These trends are all increasing as a result of the sheer number of cases occurring with this rapidly spreading variant.
In Canadian hospitals, a perfect and terrible storm is brewing. More healthcare workers are off sick at a time when more COVID patients are flooding in.
The number of people who are getting sick is going up, and it's putting increasing demands on a healthcare system where the amount of personnel is limited because they themselves are getting COVID.
Ontario and Quebec are seeing the biggest jump in hospitalizations, but all provincial health systems will be under strain at the same time. It's not clear the Canadian healthcare system can handle what's coming, and Ottawa is warning the provinces that it has only limited help to offer.
It shouldn't surprise anybody that it's not a limitless number of federal health care resources that we can bring to bear.
It is striking and frustrating for many that the majority of hospitalizations come from the small percentage of Canadians who are unvaccinated.
Just this morning on my shift, I've admitted 3 people with very severe illness with COVID, all of whom were unvaccinated. I think healthcare workers will express frustration because those are the people that will have more severe illness.
Today, the federal health minister kicked off what he believes is coming, a discussion with the provinces about making vaccines mandatory.
What will make us move through this crisis and end it is vaccination.
Testing, masking, distancing all remain important. But, says Duclos, to end the pandemic, expect mandatory vaccines to be taken up in the weeks ahead, and that will bring some controversy. Eric Sorensen, Global News, Toronto.
And here's a measure of how any conversation with the provinces about making vaccines mandatory might go. Premier Jason Kenney tweeted today Alberta's legislature removed the power of mandatory vaccination from the Public Health Act last year and will not revisit that decision, period. New Brunswick's health minister said there isn't any place in Canada looking at mandates.
It is a serious issue, but we maintain right now that education, pushing for those to get vaccinated, showing the differences that the vaccine makes, as Dr. Russell did today, that will be the path we'll stay on for the near future.
Well, parents with school-age kids are back into the cycle of trying to figure out what to do with their children. In places where online learning is back, such as Ontario, the juggling and the stress is underway again. Tonight, Abigail Bimman looks specifically at healthcare workers who are scaling back their hours so they can look after their kids.
If you know, you know. Familiar scenes of virtual learning.
It is chaotic.
In order to manage online learning for his 2 children, Ottawa pediatrician Dr. Andrzej Rachowski scaled back appointments by up to 40%, stopped staffing a kids' COVID assessment center, and most impactful, he says, stopped working at a kids' vaccine clinic.
It seems that the government in Ontario is making the return to school somewhat conditional on the vaccination rates of these children. Well, if we cannot staff vaccine centers, either nurses or physicians, because we have to stay home and take care of our children, the speed at which we will achieve that vaccination goal in this age group will just be slower.
About 20% reduction.
Child psychologist and mom Tess Clifford is also scaling back hours. She's part of a group behind backtoschoolontario.ca. In its first 2 days, about 23,000 people used it to send 180,000 emails to Ontario decision makers calling to get kids back in class.
We know that the mental health and academic and just general well-being impacts for kids have been huge with each school closure.
Now managing 3 of her own kids at home, Adrienne Matheson has, since the pandemic began, had to triple staff at this Ottawa family psychology practice, and the need is only becoming more dire. She just closed her wait list after it reached 70 people.
The length of time that they're waiting, we just don't feel as appropriate or safe.
Her practice is seeing an uptick in all kinds of mental health and academic challenges.
We are seeing a drastic increase in self-harm behaviors, particularly for our young adolescents and our adolescents.
She's even more worried about long-term effects we may not see for years.
We want to get the kids back in school, but we have to make sure when the kids back in school, they can function.
Ontario's premier again cited teacher absenteeism as a challenge. His office did not directly respond to questions about the impact of healthcare absenteeism. There is emergency childcare coming, but not until next week and not accessible to all. There have been no clear metrics for a return to class January 17th. Professionals tell us they're hearing about hopelessness and mistrust, not just from parents, but from kids. Donna?
Abigail Bimman in Ottawa, thank you. In Ontario, a remote First Nation overwhelmed with people who have tested positive for COVID has asked for urgent assistance from the military, and it's now waiting. Bearskin Lake Reserve is in Ontario's far north. Nearly half its 400 residents have tested positive for the virus. The majority of the residents are fully vaccinated, and a booster campaign is underway. But Omicron is spreading fast, and so many people are now self-isolating, there aren't enough to deliver the basic needs to the community. David Akin reports.
I'm here in Bearskin Lake. As I'm driving around, it's like a ghost town.
A ghost town created by COVID-19. Nearly half of the 400 or so residents here have the virus. The chief of Bearskin Lake himself is in self-isolation with his family.
I was on the front lines for the first few days, but I had to isolate due to my son being positive. So I've been in isolation since Monday, so I'm exhausted at this moment.
The chief says about 80% here are vaccinated. That's a rate as good or better than most provinces, and a pediatric vaccine program got underway just before Christmas.
For myself, I had my 2 doses and a booster.
But even still, COVID infections are everywhere. An 8-month-old infant among the most recent to get it. Almost everyone is self-isolating in their homes. Homes heated by wood stoves that need a constant supply of fuel in minus 30-degree temperatures. Some volunteers from outside the community have flown in to help, but they're exhausted.
My name is Stuart Kamno-Ottoman, and I'm a member of this First Nation. This is a very scary situation. Everybody that we meet, we do see their concerns, and after we are gone, who is going to take over?
The chief and council asked the army to take over. That plea for help was made Monday.
I would like to see something happening for my community, because I don't know if we can last any longer.
But the community is still waiting for an answer.
Because we're remote, and we're First Nation, people don't give a damn.
Ottawa has been in daily contact with Bearskin Lake leaders and has provided just over $1 million to help cover the cost of plane charters and supplies for this remote community.
I understand the anxiety that people are feeling and frustration because it's a frustrating situation. I mean, people are used to being able to take care of themselves. And I think, having to rely on others to meet basic needs can be frightening and frustrating.
Plans to fly in the Army are still under review. David Akin, Global News, Ottawa.
In the U.S., there are more known cases of COVID-19 now than at any time during the pandemic, more than 700,000 today alone. Hospitals are dealing with a surge in cases, and other businesses are trying to cope with having so many employees off sick. As Jackson Prosco reports, there are growing calls for the White House to come up with a new COVID strategy.
American hospitals face a double threat. More COVID patients than ever, including children, and more doctors and nurses off sick with the virus.
As the hospitals get strained, there is less opportunity to provide all these resources to the one single patient.
The incredible surge in COVID cases, averaging more than 600,000 per day, is also taking a toll on everyday life. Public transit systems have slashed service with drivers unavailable. Airlines continue to cancel thousands of flights due to staffing shortages. There's even a shortage of lab workers to process COVID tests.
The next few weeks and possibly even into the month of February are going to be pretty dismal because we are projecting surges in other parts of the country that will peak in the next 2 to 4 weeks.
In an op-ed in the Journal of the American Medical Association, several former advisors to President Joe Biden called for a new strategy, writing, "COVID-19 is here to stay. Policymakers need to specify the goals and strategies for the new normal of life."
I don't think COVID is here to stay.
Biden has so far resisted calls for any drastic shift in approach, rejecting measures like vaccine mandates for air travel.
We're going to be able to control this. The new normal is not going to be what it is now. It's going to be better.
How the U.S. gets to that better place remains uncertain. Omicron's extraordinary spread has not changed the fundamental problems with the U.S. response.
2, 3, all done.
Vaccination and booster campaigns are still lagging, and forecasts suggest the U.S. death toll could top 1 million by March. Jackson Prosco, Global News, Washington.
In the U.S., employment rose less than expected in December because of a shortage of workers. The unemployment rate fell sharply in December to a pandemic low. Employers added 199,000 jobs last month, the fewest in 2021. Wages went up 4.7%, a sign companies are keen on hiring as a record number of people have quit. Canada also had the lowest unemployment rate in December since just before the start of the pandemic. 55,000 new jobs were added, but Statistics Canada says the 5.9% unemployment rate was recorded before public health restrictions ramped up. Since then, many businesses have had to close or scale back operations. In the U.S. state of Georgia, 3 white men found guilty of murdering Ahmaud Arbery, an unarmed black man, have been sentenced to life in prison. Gregory and Travis McMichael, a father and son who never showed any remorse, were denied any chance of parole. They chased, cornered, and shot the 25-year-old who was out for a jog in a mostly white neighborhood. William Bryan, a neighbor who recorded video of Arbery's last moments, was granted a chance at parole after serving 30 years. Arbery's mother had asked the judge for life sentences.
But I knew that we would come out with a victory. Yes. I never doubted it. And I knew that today would come.
During the sentencing hearing, the judge spoke about the terror Arbery faced while being hunted by the men who chased him in pickup trucks. He said he imposed severe sentences in part because of their callous words and actions captured on video. A fierce winter storm smacks Atlantic Canada. Coming up, the warning to bundle up and hunker down. Big parts of this country are under an extreme cold warning right now. Atlantic Canada is also bracing for blizzard conditions. Global News Chief Meteorologist Anthony Farnell is here with the details. Anthony.
Well, Donna, this storm is still intensifying. It picked up a lot of moisture from the warm waters of the Gulf Stream, and it's depositing that in the form of incredibly heavy snowfall. As we zoom in, I want to show you this band that's extending across the Bay of Fundy into New Brunswick and into PEI as well. These are blizzard conditions for the next several hours. Snowfall rates of 5 to 10 centimeters every hour as well. We've had lightning and thunder snow in Halifax, another 15 to 25 centimeters for much of PEI, and then all of this moves into Newfoundland with 30 to 50 centimeters expected there as well. The winds have been gusting over 80, and that is piling up a lot of water along with unusually high tides, king tides they call them, and that means flooding, storm surge warnings extending through a large area of Atlantic Canada as well. Out west, it's been the snow, it's been the freezing rain in BC. That system will bring some snow into the prairies, but it's also going to bring milder temperatures. The wind chill still brutal in so much of the prairies. There's some relief in sight. In fact, by early next week, some locations will be back above freezing. Donna?
Well, that would be a relief. Anthony Farnell, thanks. Shoot to kill ahead, the order to use deadly force to stop the protests in Kazakhstan.
You're watching Global National.
After days of unrest, Kazakhstan's authoritarian leader says he has now given orders to shoot to kill without warning. It's a major escalation in a crackdown on anti-government protests. The situation is calmer now, but troops from Russia and other countries are still arriving in Kazakhstan at the invitation of the president. Redmond Shannon reports.
With security forces now well in control, a much quieter day in Almaty Friday. Only some reports of gunfire. This woman says she is scared and her heart hurts knowing young people are dying. Authorities say security forces have killed at least 26 people, referring to them as armed criminals. State TV is telling people to remain indoors if there is violence in their area. President Kassym-Jomart Tokayev went a step further, warning Kazakhs that police and soldiers will shoot to kill without warning. He says he will not negotiate with what he says is a coordinated group of bandits and terrorists. He gave no evidence to support his claims they are foreign trained. Tokayev reserved a special thank you for his Russian counterpart, Vladimir Putin. More Russian troops arrived Friday, forming the largest part of an international peacekeeping force invited to Kazakhstan by Tokayev. Self-described Kazakh opposition leader in exile, Mukhtar Ablyazov, is calling it a Russian occupation. Russia has a military presence in 8 of the 14 states that gained independence from the former Soviet Union 3 decades ago, including Ukraine's Crimea Peninsula, which it annexed in 2014. The Russian-dominated Collective Security Treaty Organization says its mission in Kazakhstan is temporary, but the U.S. Secretary of State expressed concerns about the intervention.
It's not clear why they feel the need for any outside assistance, so we're trying to learn more about it. Once Russians are in your house, it's sometimes very difficult to get them to leave.
Some Kazakhs around the world are voicing similar worries. Meanwhile, new video has emerged of the toppling of a statue of former dictator Nursultan Nazarbayev. He is an ally of Tokayev, but has not been seen since the unrest began. Redmond Shannon, Global News, London.
From groundbreaking roles to his singular talent, how Sidney Poitier changed Hollywood. If you were to measure the achievements of Sidney Poitier by just 1 year, 1967, it would still be legendary. He starred in 3 movies that year. All of them became classics. He was the first African-American actor to win an Academy Award. And news of his death at age 94 has led to a flood of tributes from people who adored him and were inspired by him. Here's Mike Armstrong.
Dr. Wharton, what would you have done?
It wasn't so much a career in a changing Hollywood.
as a career that changed Hollywood.
Where is it?
When Sidney Poitier started acting, there were no leading roles for African-American men. By the time he retired, there were no limits.
I came here at a time when this Hollywood that you know was not the Hollywood here when I arrived.
My father was a tomato farmer.
Sidney Poitier was born in 1927 in Florida, but raised in the Bahamas. When he moved back to the U.S. at the age of 15, he'd had only 1 year of schooling. He could barely read. He was a dishwasher in New York City with $3 to his name when he was looking for a better dishwashing job in the want ads. On the opposite page was an ad for an African-American theater.
It said actors wanted. Hey, I figured I've tried one. Might as well give the other a go.
From the stage, he moved to the screen.
Ain't it the truth?
His first Oscar nomination was in 1958 for The Defiant Ones.
The winner is Sidney Poitier.
His Oscar win was 5 years later for Lilies of the Field.
Why did you go and do that? They call me Mr. Tibbs.
He would go on to reshape how African Americans were seen on screen. He wasn't a character who accepted being slapped. He slapped back. Poitier was selective in his roles. In The Heat of the Night, he was a detective. To Sir with Love, a teacher.
Mom.
In Guess Who's Coming to Dinner,
This is John.
a doctor.
They're just as I thought.
With each role, there was a grace and dignity. That includes when his civil rights work off-screen overshadowed his work on it.
I am an awful lot of things, so I wish you would pay me the respect due.
Sidney Poitier would work well into his 70s. He was knighted, awarded a lifetime honor by the Motion Picture Academy, and a Medal of Freedom by President Obama. He was also beloved in his industry.
I never met another person who affected, protected an entire race. I bow before your spirit.
Sir Sidney Poitier was 94.
And that is Global National for this Friday. I'm Donna Friesen. Tonight's Your Canada is this wintry scene in Oakville, Ontario. We'd love to see your Canada. Please email it to viewers@globalnational.com. Thanks for watching. Take care of yourselves. Bye-bye.